Absolutely not. And I'm going to repeat this. There is absolutely no need to panic. There is every reason for us to take every precaution, but we needn't worry. So what we know about this virus is in fact very recent information that we've had over the last, say, couple of months. So we are still learning. And if you look at the latest publications that have just gotten published, I'm just going to quote from them. So we know that it spreads through respiratory secretion. So, if you are in close contact with someone who's coughing and say you are in less than 6 feet distance, then you get exposed to the virus that would be passed on in the secretions. Now, when someone coughs or sneezes and then those droplets fall on, say, a door handle or on a laptop or on a table, they will persist for some length of duration. We don't know precisely how long, but they will be present on that surface. Now, if you touch that surface, and each one of us has this bad habit of touching our face, our eyes, our nose, and sometimes we can do this up to 3,000 times a day. So now just imagine it's sitting there, we've touched the screen, we've touched the laptop, then we put the fingers on our face, and that's how it might spread. When you're climbing up stairs, the railing, it can be on any surface if someone has actually brought it out. Well, I think when it comes to prevention, there's a lot of common sense. So the first thing is, if someone is obviously unwell, someone has fever and cough, then it would make sense not to be next to that individual. If someone has been in contact with someone and has traveled from the countries where we are seeing a lot of COVID, it would be best not to be in close proximity. And again, I'm qualifying close proximity means less than 6 feet distance. And this is going to become important as we see more individuals being diagnosed in India, is that you've not been in contact with someone who's actually had symptoms, might or might not have traveled abroad. So that's one about proximity. The second thing to do is, if someone's coughing, offer them a mask if they don't have one. That helps, and you don't need a fancy N95 mask. A simple surgical 3-ply mask is good enough. If you are going to cough, or for that matter, if anyone's coughing, there is something known as a cough etiquette, and that is, you don't really cough, into your hands. You cough into your elbow. So this is the way you cough. If you have coughed into your hands, then you make sure that your hands are clean. And again, cleaning does not mean using a hand rub which has alcohol alone as the option. Good old hand washing with soap and water, 20 seconds at least. So this is something that's very important to realize, that hand washing is very effective, and it's not just using sanitizers, and sanitizers are great, but sometimes you have access to soap and water, then why not? If you have coughed into your hands, and then it's important to sanitize the hands. If you've coughed into, say, a tissue, then you dispose of the tissue properly. In terms of other preventive measures, really is that if you have been in contact with someone who you believe might have COVID, then it's better to talk to a doctor and get advice. And I'm saying talk to a doctor, get advice, because it can be very confusing if you go onto the net and try and do this on your own. Better to pick up the phone and speak with someone who's an expert and who has a greater degree of knowledge than what you will get on WhatsApp or, say, on the net, which might be posted by non-technical, non-medical people. So the symptoms are very much like the flu in some ways. You get fever, you get cough. The cough typically is dry. You can sometimes, when the disease progresses, get shortness of breath, what we refer to as dyspnea. You can get fatigue, you can feel very weak. And of course, some amount of gastrointestinal symptoms have also been reported with COVID, which are not seen with the flu and some of the other respiratory viral illnesses. But it's very hard to make this clinical diagnosis. It's quite difficult at times, just based on clinical, and that's why you test, and it's easy to test for flu. We have the kits, and you get the diagnosis a few hours later. And of course, if one is concerned about COVID and one needs testing for COVID, then the government has authorized laboratories that can test, so one needs to actually go and give the sample there. The sample is simple, it's not a blood test. It's oral, which means from the mouth and from the nose you take swabs, and then these are looked at by sophisticated microbiology techniques. It's called RT-PCR, and then it confirms whether an individual has COVID or not. This is a question that's been agonizing a lot of people, because let's face it, there is a lot of fear that has been generated, and there are lots of misconception and myths floating around. How infective is COVID? Well, COVID is quite infective, there is no doubt about that, but it isn't the most infective that we have seen in medicine or we continue to see in medicine. To give you an example, one individual with COVID-19 is likely to infect between 1.5 to 3.5 individuals. There are exceptions when someone might infect more, the super spreader, but then that's uncommon. But it's between 1.5 to 3.5. Now, in contrast, chickenpox, that each one of us is very familiar with, an individual with chickenpox will usually infect 8 people. And someone with measles will usually infect 15 people. So look at 8, look at 15, look at between 1.5 to 3.5. Well, I think the reason why there is a fear psychosis, why are people so scared, is I think because of a knowledge explosion. So let me give you an example of another of an epidemic, or it was actually a pandemic that we saw. And many of us would remember that there was swine flu that actually broke out in 2009. The first cases were reported in Mexico, and of course greater awareness and resulted in then development of diagnostic testing, and of course cases were diagnosed everywhere. But was there that kind of fear psychosis like we see this time? The answer is no, and I tell you the reason for that is simple. 2009 was the birth of WhatsApp. 2020, 30 million messages are posted on WhatsApp every minute. 300 million individuals in India are on WhatsApp. So what is happening is that everybody who hears anything, gets anything posted, forwards it, and you don't even know, you can't even quantify it, that how many people saw it. So what's happening is there's a whole lot of information that's going on. Some of it is correct, a lot of it is factually incorrect, and it's resulting in a lot of fear among people. So I think the reason why it's been built up so much is because of the kind of visibility that COVID-19's got, and also the kind of world that we live in, where we are so intertwined, so connected, that information gets passed on so easily. And I think we need to see the availability and access to social media as an advantage to us, because it gives us a fantastic tool. It gives us a tool that's cost effective to actually educate and, very importantly, empower. Because if you're educated, you're knowledgeable about it, then you will make the right decisions, you will not panic. So I think our duty as healthcare professionals is really to make sure that the correct information goes out to as many people as is possible. Some of the work that we've actually put down on social media, we had about 1 million impressions from that we posted out of Apollo hospitals, and we want to keep doing more and more of that so that we are able to give access to correct information. Well, if we look at the highest risk of dying with some of these infections, the highest is Ebola, following which is MERS, which we saw in the Middle East. And we will have a risk much lower than Ebola and MERS with the COVID. It's lower than SARS. But yes, it's higher than regular flu, the seasonal flu, the influenza that we are very familiar with. The picture is still becoming clear on what the mortality rate is. The WHO gave out figures of 3.4% overall today. It was thought to be a little less, but I have to say that the assessment won't be very precise at this point in time, because the people who get tested are the ones who have very obvious symptoms. There will be a large number of individuals who will have very mild symptoms who will not get tested. So when you look at the cohort that you are testing and you're looking at death with the total number of patients or individuals diagnosed, you'll get a percentage. But actually there are a large chunk of individuals who were not tested. And so if you were to take that into account, I believe this figure will not be as high as 3.4. There is also data to suggest that outside China it's much lower. Well, what we now, based on the understanding from China, is that if you have a coexisting medical condition, you're obviously at a greater risk than someone who's actually healthy and has no other risk factors. Older individuals older than 60 are at a greater risk. Males slightly more than females, it's about 56% compared to 44% in females.
And what about the children?
Well, it's very interesting that in China, the number of children who got affected with this were much lower than was expected. And if a child gets it, it's a lot milder. So that's reassuring from a parent's point of view. So that's a very important question, because many of us have professions where there is a degree of travel involved. So the way I would advise looking at travel is to look at what the advisory is. So if we are looking at international travel, the Government of India, WHO, there are lots of advisories coming about which countries to avoid and so on, and the Government of India is also issuing that. So one should look at that. When it comes to domestic travel, at this point in time, there is no concern. Of course, it would seem logical to avoid crowded places if you can, but that doesn't mean that we're going to stop mingling and we're going to stop interacting with people. But obviously, it's something that can be classified into essential travel and non-essential travel, and if non-essential travel can be deferred, it would seem logical. That's a question we don't really have an answer to at this point in time, but one would hope to have an answer. At this point in time, if a pregnant lady gets exposed to someone with COVID, she would be treated exactly the way someone who's not pregnant. Well, I think it would be great to get some telephonic advice and get some clarity. Sometimes all you need is a little bit of reassurance from someone who understands this condition. If it's a question of testing, then the government has designated facilities where testing can happen. And then if the test turns out to be positive, then the admitting facilities have also been defined by the government in different parts of the country where an individual needs to be housed. And the reason for that is because you want to protect the healthcare staff, you want to protect other individuals who might come in contact with this person who might have COVID. And so you need to make sure that there's enough protective equipment available in that facility. And so the government is being very cautious, and I think we need to applaud the government for the way they've actually approached COVID, from the evacuation from Wuhan to all the other measures that have been put in place. We need to strictly follow the advisory and then go to a facility where which is designated as a COVID treatment center. Well, at this point in time, the treatment is really supportive. Now, if someone really gets very ill and needs respiratory support, goes on to a ventilator, then there might be need also for something known as ECMO. So it's really intensive care settings should the need arise. Otherwise, be in isolation and get symptomatic treatment. There is no specific treatment as far as today is concerned, but this might change in the next few weeks. There are some medications that are being tried. I won't really want to go into details, but there's some antiviral drugs that we use for other conditions. Combination of that might work. There's an anti-malarial that's being looked at in those who have developed pneumonia, and so this is really work in progress, and I believe that we should get some evidence that something works, and we should get that in the next couple of months, I believe. Well, there are several different vaccines that are being looked at, and I think there is at least one candidate vaccine that is now moving into the stage of trials. And the good thing is that after we were able to characterize the genome, and with certain advances that we have, it's possible to create a target vaccine relatively quickly. In the past, it would have taken years. But of course, it has to go through trials, it has to be tried in human beings, and there are phase 1 trials, phase 2 trials that need to be completed before it can be licensed for use. And even if trials are fast-tracked, the process itself takes time. So, it's unlikely that we will have a vaccine in the coming months. So, it could be the end of the year or early next year. This is a question that's uppermost on everyone's mind. When will it end? At this point in time, we don't quite know. What we've seen in China is that with the kind of containment strategies that they employed, the number of cases have considerably gone down. So, if we look at it, it's been a 2-month cycle there. Now, it largely depends on how much of the condition is seen in a particular geography, what are the measures to contain it, how effective are they, what is the kind of cooperation that one gets from the population at large, what are the weather variations that might actually contribute to this epidemic moving in a particular direction. And I know a lot of us are hopeful that the heat in many parts of India will work to our advantage, and the virus will find it hard to survive temperatures of 35 and 40 and 40 plus. But these are questions that we don't have answers to, but we hope and pray that it sort of gets contained, and that in the coming months we can say goodbye to COVID-19. The interesting thing is that many of these epidemics, they come, they sort of peak, then they stabilize, and then they go down pretty quickly. We saw that with swine flu, that after about a year the WHO really declared that it no longer is an epidemic. Well, I would want everyone in the HCL family to not worry. There is absolutely no reason to worry. Of course, there are many reasons to take precautions, and we are all intelligent, well-read individuals in the HCL family. So I think educate yourselves, constantly educate yourselves, because the knowledge is going to change, and it's not going to be weeks, it's going to be days, because every day we are learning something new. There are more and more publications that are coming out. So educate yourself, but educate yourself from the right sources, and use that education to not only empower yourself but empower everyone in your vicinity, friends, families who might not have access the way you have to information. And let's stop using words like worry and concern. It's been a privilege interacting with everyone at HCL. Thank you very much for this opportunity. My name is Anupam Sibal. I'm the Group Medical Director of Apollo Hospitals and a Senior Pediatrician.